Hello, I'm Dr. Leigh Berry from Hands-On Chiropractic, and today we're going to present a case about neck pain. The patient was a 54-year-old female who, after several traumas in her life, including a work-related injury, presented to our office with severe neck pain radiating into her arm, hands, and fingers. And at times, the radiating pain and the neck pain would cause swelling in the arms, swelling in the hands and fingers. And upon postural exam, she was found to have several shifts. As we go through traumas in life or work-related injuries or even whiplash from car accidents, it can start to cause our spine to shift to one side more than the other, or it may cause our head to start to come out in front of our body more than it should. And so those are some of the postural shifts she was showing. Upon examination, she also showed reduction in her ranges of motion, meaning, she wasn't able to move her neck everywhere that it showed without creating pain or stiffness in her body. And she also showed some postural distortions on x-ray. In chiropractic today, we actually know on x-ray what the shape of a spine should be. So that's why we take x-rays here, and then we can show to a patient if they have the correct spinal structure or if there have been some alternations in the traumas that they've been through. The neck, as it goes through traumas throughout your life, slips and falls and car accidents, those things will start to cause the bones in your spine to shift around. And as chiropractors, we call that subluxation. Once you start to have subluxation in your spine, the muscles will start to become irritated, they may spasm, they become tight, and then what will happen is the nerves will start to have pressure on them, be it from the bone is shifted out of place, or maybe the muscle is spasming around the nerve. And so that's what causes people to have pain, not only in their neck, but perhaps pain that is shooting down into the arms. Sometimes people have it in the legs, into the hands, and this is why this patient also was showing signs of swelling in her arms and hands and fingers. So in our office, we actually take some time to show the patient the x-ray and then go over everything and all the findings we have and actually let her know what we think it's going to take to correct her spine. So we did that with her, and she agreed to go for some correction of her spine. And so in this office, what correction means is a couple of things. Of course, adjustments. For us, the adjustments will be mostly postural in nature. So as we were talking about those postural shifts that happen over time in our life, our job is to actually reduce those so that the pressures on your spine and your muscles in your body are equal on both sides. So that was part of the program for her. The second part of the program for her was actually try to restore the curve to her spine, which she had lost. And we're going to talk about that as we look at the x-rays today. And correction will come from a process that we call traction in this office, which is designed to help the adjustments hold longer. It's designed to change all those muscles and retrain all those muscles that surround the spine so that the change is more lasting. So the goals are, number one, for her to feel better, and number two, for her spine to change, and number three, for us to actually be able to keep her spine maintained in the new, normal, healthy position. As you have subluxation in your spine, the longer it's in there, the more chance there is for it to cause degenerative change, which is also known as arthritis. So when those kind of things start to set into a spine, it does take some time to actually make those corrections. Usually a patient will start to feel better before their spine actually starts to change. So if you'll look at this first x-ray, here's the patient's chin and here's the back of her head. The black line is going to show you the shape of her spine. The red line is going to show you what I would like it to be, or that C-shaped curve. So when she first showed up here, her curve was too straight in her spine. Down towards the bottom here, if you look closely, you'll see some degenerative change happening. What that means is some of her disc height was decreased. There was some bone spurs starting to grow on the tips of those bones. That's important in this case because those nerves do come out of your neck and go down your arm into your hands. So that's why some of the reason why she was having the problems she was having. In this picture, she had 71% loss of her curve. And this is her post picture. So after some care, you'll notice that her black line is much more curved. much more close to my red line. Now instead of 71% loss, she has 24% loss of curve. The degeneration is about the same, but the goal in this care is to make sure that degeneration doesn't progress or get any worse. So the great news is, because this person chose to have her spine corrected, not only does she feel better, but now she does not rely on painkillers any longer. Her quality of life has been restored, and because the structure of her spine actually changed, the likelihood of her ever going through this again is very low.